Alan, we shouldn't be really too surprised, right? Because, when cases in our community go up, guess what? There are more chances that the virus will end up in our schools. Now, the state count includes kindergarten through K-12 and college and university. So, what about the reasons why the virus is spreading faster based on age groups for young kids, right? Like I do, they don't even think about the virus, right? They're touching their face, they want to talk to each other, they gather in groups and they want to play most of the time, again, they don't really think about the virus. Now, if you have a teenager or college students, well, they think they're invincible, right? They think this is not going to affect them. Their brains are still developing, however, and they don't always think logically. So when all these kids are in school, it's really imperative that they follow safety protocols, in my opinion. And it can be quite challenging. In fact, kids have snack and lunch breaks, right? And that provides more opportunity for what is that for them to get together and possibly spread the virus and when their masks are down, et cetera. So I think that it's really important to be able to get them to understand every single thing they do, every act is important to contain this virus.
And Doc, the irony of this timing is that there are many districts looking forward to returning to learning in person within the next couple of weeks. So do you think schools will have to close again?
That's $1 million question, right, Glenda? I mean, the thing is that we're in uncharted territory, right? So school districts have to kind of look and see what's going on in their area. And for those who have in-class instruction, some of them have to, already have in-class instruction. They may have to temporarily close. It's happening nationwide and in other countries as well. But here's where I think it's so important. We have an opportunity now to get the data, look at the data. The data we're getting now is what happened 3 weeks ago. So now if we see the signs, we really can tell our kids it's super important to do it. No more COVID fatigue. We really have to, as adults, make sure they understand they have to wear a mask, disinfect, wash their hands, social distance. We have to look at these are the signs, tell our kids even more. And we know that most kids, right, are not going to get severely ill. Some will. I don't want to discount that, but most won't. But they're going to pass it to grandma, grandpa, or their parents with underlying health issues. So this is where I think as a community, we can look at this data and say, we have an opportunity to break it, right? We have an opportunity to make a difference and do the things we need to do. And what that'll do in the long run is to keep schools open and have life go back to what it used to be. So I think the sacrifices we make now will pay huge dividends. No more fatigue of living under COVID, and really telling our kids why it's so important. It's essential because then the future numbers will be better.
All right, Dr. Nandi, thank you. We always appreciate your insight.
My pleasure.